Hello everyone. So there has been a request to do a video on implant genesis surgical kit and as well as packing of the implant. So today I will do a small video on the surgical kit as well as the packing of the implant. Coming to the surgical kit, this is the implant genesis surgical kit. This is how we open it. We press here and this is an autoclavable one which is also written here, and this is just a tray here now. And in the kit, in any kit, you have 5 components. The first component is the drill component. The second one is your implant driver. Third one is your hex driver. Fourth one is your paralink pins. Fifth one is the torque ratchet. So we have 5 components in a surgical kit. Coming to the drill components, the first drill which we have is a lance drill. If you see, this is the lance drill. This is a pointed pokey drill which does not have any measurements. This is only used to pierce the cortex. This one is only used to pierce the cortex. In maxilla we go 2 millimeters, in mandible we go just 3 to 4 millimeters. This is only to mark the area where you want to do your future osteotomy. If you want to place an implant in between these two osteotomies, this will act as a marking point. So lance drill is only to pierce the cortex. It is not for the angulation and it is not for the depth. Coming to the next one in your kit is your pilot drill. Now pilot itself tells you that this is going to guide you properly through the osteotomy, and this one, it has got measurements like 8 is the lower one, 10, 11.5 and 13. We have these measurements. The black band lower one is the 8. The next black band upper margin is the 10. Then you have your 11.5 and then you have your 13 millimeters. So what is the importance of pilot drill is, whenever we are doing an osteotomy, I only do till 8 millimeters. And then I take an RVG or an IOPA to check whether my angulations are correct or not. If my angulations are correct, suppose if I am doing somewhere like an 11.5 mm implant, 5 into 11.5, then I will go till the depth which is the 11.5 after confirming my angulation of my pilot drill. The next subsequent drills which you have 2.8, 2.3, 3.4, 2.8, 3.8, 3.4, 4.4, 3.8, 4.9, 4.4. Ideally they have 2 measurements for every drill. If you see the pilot drill also, it's only measured as 2 and 2.3 mm drill. But why these 2 measurements are given? If you see the drills here, the drills have step. The drills have a small step at 4 millimeters. So what does this step do is, the smaller diameter of the next drill is actually the larger diameter of the previous drill. The larger diameter of this first drill will become the smaller diameter of the next subsequent drills, which is only for the 4 millimeters. This is because we don't want any jumping motion of the drill. So when you are doing the osteotomy, suppose if you are using a 2.8 drill, the first 4 millimeters belongs to the pilot drill, which is a previous drill, and this will avoid confusion and it will take only parallelly to that step. So this step drills, if you see the step here, the step drills will allow you to go passively for the first 4 millimeters and then actively they cut the remaining for the 2.8 millimeters. So this is a 2.3, 2.8 drill, which means the first 4 millimeters is 2.3, which corresponds to the larger diameter of your pilot drill, and then you have the 2.8, which is the larger diameter of this present drill. Now the next drill is 2.8, 3.4, which means 2.8 is the smaller diameter of this drill, and then 3.4 is the larger diameter of this drill. Now the same thing will repeat to the next one, 3.4, 3.8. Same, 3.4 for the first 4 millimeters and then 3.8 is the larger diameter. This larger diameter will become the anterior or the smaller diameter of this the next drill. So this is 4.4, this is 3.8, this is 4.4, and the last drill which you have is the 4.4 anterior or the apex, and then you have the 4.9. Now what happens with the drills is, whenever you have the implant sizes like this, like 3.5, 3.75, 4.2 and 5 mm. Whenever I am doing a 3.5 mm implant, I only go half of the amount of 3.4 drill. Always remember to count that the highest number belongs to the drill size. So I only go half of the diameter. Suppose this is 11.5, I only go till 8 millimeters and then I stop the osteotomy and they start placing this implant. Suppose if it is 3.75, my last drill will be 3.4 drill and I go till 11.5 and then I start placing the 3.75 drill. Suppose if it is a 4.2 mm into 11.5, I take the 3.8 drill and I go till 11.5 and then I start placing the implant. Suppose if it is a 5 mm implant, I go only till 11.5 of the 4.4 drill and then I start placing the implants. But in some instances, if the cortex is thick, then only I use the 4.9 drill, that too only for 4 to 6 millimeters, not more than that. Coming to paralleling pins, we have 4 paralleling pins. The paralleling pins will help us to assess our guides or whether our angulation is in the correct direction or not. So between the two osteotomies, you keep the paralleling pins and see whether they both are parallel to each other or not. So if they are not parallel like this one, you need to change your orientation and angulation of your osteotomy in the future osteotomies. So this is about paralleling pins. Now the next one which we have in the kit is your implant drivers. Now we have 2 sets of implant drivers, which is the mini and the regular. The mini is used for 3 mm and 3.3 mm implants. The regular is again used for the remaining 4 implant sizes which we use, that is from 3.5, 3.75, 4.2 and 5 millimeters. So if you notice it very clearly from close by, you have a peak here in the driver. So this is an engine driven implant driver. This fits into the implant and you need to place the implant with this, with 30 RPM and 30 NCM torque into the osteotomy. This one. And this is a manual driver which you don't have any peak for this. So don't take the implant with this. If you take the implant with this, there is no peak in it. So it might slip and your implant might fall onto the floor. Now these implant driver will go into the torque ratchet. So this is the torque ratchet. Whenever you are placing an implant, if in, you are seeing in, that means it is taking the implant in. If suppose it is written out, that means you are taking the implant out. So again, there are some torque values in this, 10, 20, 30 and 40 and infinity. After 40, why infinity is given? Because most of the companies knows that after 40, if you are still increasing the torque, that means your torque ratchet is breaking. That means there is high amount of torque on the implant onto the bone. Hence, there might be some amount of pressure necrosis. Hence, after 40, it is only infinity. Now, to adjust the torque ratchet, to decrease it, rotate it anti-clockwise, and to increase the torque, rotate it clockwise direction. And whenever you are tightening, I will show you the grips at the later aspect. This is about the implant driver. Always keep the implant with your peak, with your engine driven, with an implant motor, and then after keeping the implant, tighten it with the non-peak implant driver which does not have a peak with the torque ratchet. Okay, and always in such that it takes in. The next component is the hex driver. The hex driver is for all the prosthetic things, from cover screw, healing cap and the prosthetic screw or the abutment screw. We tighten it with the hex driver. Hex driver also fits into the ratchet. So for an implant, the minimum torque for primary stability is 30, but for a hex driver, when you are tightening an abutment screw, it should be only 20. And whenever you are tightening a multi-unit prosthetic screw, it should be only 15. So remember, 20 is the torque for the implant genesis active implant for a prosthetic screw. This is the hex driver. And there is one more component which is present in the kit, which is called the drill extender. Whenever you have 2 teeth in between and when your drill is not going completely to do the osteotomy, then we keep the drill extender such that it extends and you can complete your osteotomy in such a way that you can finish it with to the desired length. So this is the use of the drill extender. So this is a 3.75 to 11.5. I have a dummy implant with me for a dummy model. So how to open? So most of the time I have seen dentists getting confused with the opening of the packet. They open here somewhere. Just break the seal here and open it. So once you break open, you have two stickers in this. One sticker will be there in your case sheet, and another you can keep this in your patient's record. And then you have the prescription pad, prescription of the implant genesis, which is the important thing for us to keep for after getting the FDA approvals. And this is the implant packing. This is how it comes. And once I open it, see the seal is there and it will break like this. Anti-clockwise, once you rotate, the seal breaks, and then you can drop this onto the sterile area. Now once you have dropped it onto the sterile area, what you notice is you have a stand which will be present in this, right? This is only to hold the implant in position, the container in position. This is just a stand. It does not have anything. And the next one, you have a titanium housing, and then you have a plastic housing with a small cap. Now don't remove this cap first, because it contains cover screw and it can fall anywhere else when you are operating. So the plastic housing always contains the cover screw. So don't open the plastic housing. So the cover of the plastic housing, this entire plastic housing, if you remove it anti-clockwise, you can see the implant which is present in this. Now how to pick an implant? Now you can see you have an implant driver which has a non-peak one, and if you do like this, it will not attach, it will not come, it will fall. So what you need to do is, don't touch the implant like this. Always try to take the implant with your implant driver which has a peak, such that it gets locked. That sound has to come. Once that sound comes, see, even if I am moving in any direction, this implant will not fall. And then I start engaging it in the site where I want. I should keep it with the engine. I am not keeping it with the engine now. So I tighten it. Once I get the primary torque, then I take the implant driver which does not have peak. Then I have a torque ratchet with me. I adjust the torque to 20 or 25, and then I start tightening it. So whenever you are keeping a grip, this is most important. Your finger has to be placed onto the torque wrench, and one finger should support the mandible. This is how you have to rotate. If you don't rotate like that, it will wobble and the osteotomy might spoil or might get damaged. So keep one finger like this and then start rotating. Slowly, slow, steady and constant force will give you a very good torque. Okay. And see this, I am about to reach to the crest of the implant and I got a torque which is more than 25. So now I will adjust it to 30. So this is 30. If you can see, that is 30. Now I am adjusting the torque. See, I got 30 torque. Now where is my implant? My implant is just on the crest, but I want it to go little bit subcrestally. So my grip is the same. I keep my hand here and this is my torque ratchet. My grip is the same. I just went in 0.5 millimeter subcrestally. So always keep your implant genesis implants 0.5 to 1 millimeter subcrestally, which will help for you in the future processes and also the success of the implant. Now what I have to do is, this is the hex drive which I have got, and this is the plastic housing which I have got. The plastic housing contains your cover screw. Engage the cover screw with your hex driver. And how to hold a hex driver? Most of you are holding like this and started rotating like this. It might fall into the throat. So don't do those things. So what is the best thing which you can do is a 3-finger grip. Remember the 3-finger grip, your forefinger on the top of the hex driver and your middle finger and the thumb is used to rotate the hex driver. So what I will do is, see, I just keep it like this. After I usually keep some antimicrobial gel here. before placing the cover screw, and then the 3-finger grip. Once I keep this finger here, I use the thumb and the middle finger to rotate the cover screw inside. So if you can see clearly, my finger is always there. I rotate it like this, and then I unwind it, and then again I tighten it. So always, it is always better to tie a floss to this hex driver such that you just have a, you will not lose this into the throat. So this is about the Implant Genesis surgical kit. So hope you understood, and if you have any doubts or any other queries, kindly keep a comment in the comment section such that I can get back to you guys. Thank you.